So, our today's guest is Dr. Kunj Gor, hailing all the way from Gujarat, India, as he's an upcoming internal medicine resident. Welcome, Dr. Kunj.
Hi, thank you so much for the introduction.
Yeah, and once again, congratulations for matching.
Thank you so much.
Dr. Kunj, before we begin, just give us an introduction about yourself for the viewers.
Sure. I'm Kunj Gor. I am a graduate from Srimati NHL Municipal Medical College from Ahmedabad, Gujarat, in India. And I started my USMLE journey just couple of years ago in my internship. And with the roller coaster rides and unsureties and unplanned moments, I landed up with math cycle this year and matched into internal medicine position, a categorical position at University of Alabama Montgomery program. So now incoming PGY1 at that place.
Okay, seems like an interesting story. So, looking back at your med school, it seems like you're indeed a hardworking student in terms of that.
Yeah, it's like we all are hardworking. I would just not say it's me. It's all of us.
Being in medical scenario, we all are.
Yeah.
Okay. So, what took you something like what things you did to be right on time and to apply fresh?
Yes. So definitely, I did start my journey a little late when I was pretty much confused in my initial months. But when I was unsure, I had my first rotation in the United States, and that's what inspired me. At that time, I had met some of the preceptors and my great mentors there who really gave me a very good timeline and kept me up throughout this whole process. So one of the most and the taxing thing I would always break down in this journey would be first thing exams, second thing profile and everything. So when you have to balance between the two, it's the most crucial thing you have to do it. And always and always, that's where you have to value one thing about the other and not worry about things what is not in your hand. With that balance, I was pretty much able to do well with my help of my mentors and my seniors. And that's what made this process pretty smooth, even though in a very short span of time.
Okay. Okay. So let's hear something from you. Like, I do things I like to do, not because it should look good on my resume. That's
Yep.
something we got from your submission that caught our eyes.
Yep.
I
uh, exactly. So that's a primary thing I always tell everyone, all my juniors or anyone who approaches me. In because everybody sees and studies the math cycle every year, everybody looks at things. We all think of how can we build our resume. In all this process, we don't see what we like to do. It's like everybody looks at the resume and everybody's like, oh my god, there's a research profile everyone wants in their life, but we just don't want to do research just because we want that on our CV. We want to do because we want to learn something, we want to have fun doing it. It's the process that you want to fall in love and not just the outcomes which is it's providing. If you start that way, it will never be taxing.
It's just coming on the vibing you're having right now live with me. Like seriously, most of the people get frustrated or like daunting over, oh my god, we need to do this, that something is remaining. But having such kind of approach, it's really good. I think from this, like most of the IMG should adhere to this because this will drastically change the approach they are having for this journey, right?
Very true. Very true. Because as an IMG, yes, the we all have our very different struggling stories, and we try to reach out to things, and there are hurdles. There are always hurdles, and whenever the failures start hitting us, we are little more like overwhelmed with it. It's okay. The process makes you stronger, but having someone to say that hey, it's okay that this process it has been through, like I have been through it, you'll also be through it, so that makes you more comforting. So that's what I try to do always.
Definitely. Having a mindset that is positive enough to approach a thing, that will definitely land up in good way.
Thank you so much for your compliment.
Yeah. And like being the second generation doctor in your family, you got a great support from your home. So, like, how this influenced your journey?
Uh, so I have grown up with my parents having their practice very close to my house.
Okay.
So uh, being the first generation doctors there, they had pretty much struggles, even establishing financially and everything.
Mm-hmm.
I remember I was at times babysat at my front desk, and I just watched them growing to the patients. And one thing they kept on reminding me throughout this process is we don't become doctors to just charge our patients and have a livelihood. Definitely, it's a place which feeds the bread to the family, but the practices should always be fair. And this has always and always pushed me into pursuing medicine as a vision that you think for yourself. If you were a patient, what all expectations you'll have from a doctor. You want him to simplify the condition you're going through. So as a doctor, it's my responsibility to know more on what he's suffering. If I don't, I need to go back to the books, find the latest information, see the updates in the guidelines, look at what suits him the best. And that's when I try to make sure that I'm trying to meet the expectations of my patients. This is what, as a second generation, I had a benefit of looking at the journey long way.
You got really close experience, like really close exposure to all these things.
Yeah,
I might say.
I guess I am lucky enough, so I would definitely be there to share it with you guys.
Yeah. Thank you. You're already doing that. It's great work from your side.
No, thank you.
Okay, so let's indulge into like how many programs you applied for and what was the basic criteria for selecting these particular programs?
So, definitely, choosing where you want to go is a very important thing to know. And pretty much we all are clueless when we start searching for the programs. You must have heard about university community, and just community hospitals. And there's just a flow of everybody wanting to go to university hospital. But you really want to understand what is the difference between the two hospitals. Now, university programs are definitely programs with very good academic support and very good approachability to fellowships and other options. You always have those specialties already well established in those hospitals, and you have those consultants. But apart from consultants, you have fellows who are just 4 years elder to you, whom you can bond with really well while you are working with them on fellowship. While in community hospital, you have an experienced faculty who is there as a specialist. You need to work directly with them. You might not have specialties, the fellows in that program for the given specialties, but you get to have that direct touch with the faculty. Secondly, community programs are established hospitals which will have its history in like deep rooted histories of that hospital being there in that area for 30, 40 years. So it has a very, very good catchment area of the patients. Okay. So you get a first-hand exposure to a lot of patient flow, and that's where you get to have more and more simplistic as well as interesting cases.
Got it.
So understanding that what kind of hospitals you want to develop yourself into, that helps you understand where you want to apply. With this, we can start a research of programs, and then there are available sites which you can use like Frida, which like Residency Explorer. And Residency Explorer is something you get as soon as you issue an ERAS token. Yeah. So a lot of people might not know it, but that is an amazing tool where you can just log into it and can filter yourself like with your scores and everything, and they really give you a percentage of match rates into the program. Okay. So when I was searching for program, I was looking for places which are IMG friendly, definitely, because I really wanted to look for people I can connect with. I would like to, they would, it would be better for me to connect with them and share the same set of struggles daily while working with the patient. Maybe communication will be a primary factor, so they might know. They would be able to guide and correlate with me and help me out better than anything else. Secondly, I was very much looking for somewhere where I could get a very good patient exposure.
Okay.
Because I really want to understand the patient setup. It's a different set of patients there, and while being on a rotation, I was pretty much sure of what they were looking for in that, like a particular area, set of patients in the particular area were looking for from a doctor, and how can the rapport be established between them. So my target was more about a community hospital or a university affiliated community hospitals,
Okay.
which have the benefits of university, but while still have that set of patient flow that I can have primary interaction and can directly work with consultants.
Okay, so like you also wanted like not to be very much homesick in that way also, colleagues around you, and at the same time patient exposure.
Yes.
Okay.
Same. Definitely, that was one of the key factors. I was also looking for some comfort zones as well as some challenges which I could find at my workplace.
Definitely.
And so I did definitely broadly apply. As an IMGs, we definitely need to broadly apply to many programs. And also, selection of programs should be based on what you're targeting.
Yeah, got it. So you got around and round all that perspective with you. Good one.
Yes.
Thank you for that. And like how many interviews you're able to secure from like these many programs you applied?
Yes. So I had a pretty uncertain cycle. I landed up with 4 interviews only.
Okay. That's great.
Yeah.
Ultimately, you landed here. That's a great thing then.
Yep. Securing interviews has changed its definition with the interviews going virtual. Uh, One thing I would always look back into this journey, and I would always have advised what I missed doing it to secure more interviews, was proactively approaching them initial phase of the cycle. Most of them, with the beginning of the cycle, would go ahead and approach as many people as possible. Maybe sometimes as cold emails or cold calls to the program coordinators, or attending meet and greet sessions, and all of that starts really well in the beginning, right in August or July, where the cycle opens up. There are some meet and greets which you need to attend, where you can network, know more about the programs, and all of those things is where you try to secure an interview. You try to, being an IMG and having very limited rotations this year, and due to COVID restrictions, they were they should also like they should also have doubts like whether what kind of candidate they are going to hire. In that way, you need to establish that trust. So it comes through your application as well as your proactive approach of going to them and showing them that you are interested into that program.
Yeah, moreover, they're looking for colleagues with them.
Very true.
Yeah.
It's a medical practice now.
Yeah.
So they're looking for your practice getting into the same mindset with all the other people.
Yeah, how you blend with them, how you gel on each other in the later phase.
Very true.
Okay.
We as an IMGs definitely have that hierarchical structure we follow in our medical schools in India, where we are little bit afraid to approach professors.
Yeah,
many a times.
definitely. We are so horrified from them, we can say that.
I would really say, like recently, we are searching for housing where we are going to stay at our program, and we have our program directors and associate program directors helping us. That hey, I would say that they would recommend us areas that hey, please don't go. I would say the housings are pretty cheaper here rather than there. You would spend more. Commute will be a problem here. All those discussions we are usually afraid to make, but they are really, really helpful in that sense. So never be afraid of communicating.
Okay.
Yep.
Okay. So, like, secondly, what kind of USC you applied for? And the later part, how was your LOR obtaining experience from them?
So my first USC, which I went to, I went with an approach that I wanted to make sure that I like the system there, and also definitely wanted to learn something out of it. So when I went there, I knew that I had to project a set of skills which I have developed from my med school, and also I never had an idea that I definitely want a LOR from them, but I was clear that please evaluate me and help me grow. I would like to know myself more at the end, by the end of the interview, like the process.
Okay.
I approached them through one of the agencies where I secured a rotation at with a preceptor in his private setup as well as who's affiliated with the university. So we had the advantage of looking at both the systems, like the private practice as well as going to university.
Okay.
This was back right before the cold wave hits us,
You
and
got lucky then.
rotations got closed. So by the time um, uh, the rotations ended, we had to we didn't have to terminate the rotation, but as soon as it ended and I reached India, situation started becoming different.
Yeah.
Uh, this was the first USC I had on my CV, and however, I stayed in touch with them because you definitely want to look into, like, you want to keep in touch with them. And the preceptor was very supportive. He was checking on how was I doing, and I was taking back, like, keep on texting them by time to time. Uh, Soon, when I had limited USC to show, he was there to vouch for me with a letter, and he definitely furnished a very good letter from the interactions we had in the clinics.
Okay.
So my that was my first USC. After that, I got a window period where the cases spike was a little low. The Delta variants were about to grow. The wave was not yet started, and my internship ended in India. So I definitely started looking for places to go there, and there where I asked my preceptor that if he has any openings available in United States. And he said, yep, there is a research project going on along with a couple of physicians. Would I like to join?
Mm-hmm.
So that's how I landed up to a second research position with the place, and that's how I secured another rotation as a research fellow into the team. Uh, Third thing which came up during the research fellow, I was also studying for my step two, so I was not very much concerned about what I need to do. I was very much limited to my research work as well as meeting the targets of my study goals. And after finishing that, I had a couple of months left in the United States, so I knew that by the time I was too late to secure and apply. And the second best route was again to go back to the preceptors I'm working with, and I asked them whether if there are any available rotations I could seek for. At that time, the university started to open, and the rotations were there. So they quickly pointed out that how about you mail them, and I mailed them, and luckily the position was open. So I got my third best rotation there in the same university setup into their hospital, and where I could rotate and work as an observer, definitely. But there was a lot more to do as an observer, where I could also get some hands on at certain levels in interaction with the patients.
Yeah.
So do not be hesitant if you are performing really well in your observerships also, and if you have developed that confidence, those preceptors definitely give you hands on and definitely give you a chance to work on EMRs, also talk to patients freely, and they would support you in all your ways.
Basically,
Secondly,
yeah.
sorry,
Yeah, you should
secondly,
continue.
one last thing, like all of these rotations, whenever you start, I've seen people coming up with a mindset that, hey, it's just for a LOR, I need to work here. So you don't want that mindset. It's not just about LOR. It's about you learning yourself in the workplace, as well as you trying to project what you have learned.
Got it.
Indirectly, that will furnish your LOR. But be there, learn, and project.
Got it. So like reflecting yourself, reflecting everything for yourself.
Yep.
Okay. And like networking also, that's the key to reach good places.
Yes.
Okay.
So definitely networking would come up directly when you're working with them. When you're doing good, They'll talk to you. You'll have some frequent chats about your future opportunities, and then they'll be very much confident in helping you network among their circles.
Okay. That widen your horizon in that way.
Yep, yep.
Yeah, okay. So, like, after this, what were the challenges you faced being an IMG?
A lot of challenges actually. So when I shortened my cycle, I was pretty much dicey to apply this very same year, as with limited USCE and uh, uh, definitely not very heroic stellar scores or heroic profile. I was very much afraid of uh, match process. And there's a lot of negativity if you go around on the groups, on the broader pages, and start searching for yourself. Once your mindset is negative, you will always overlook all those positive posts which also come in between. All you see is, okay, there's nothing, there's nothing, there's nothing. Don't go around that way. Stick to your instincts. Even if they say, okay, they are not providing rotation, there's no harm in mailing and asking them whether you do or not. Uh, those were the challenges where I have mailed a lot of people, and sometimes there's no reply, and there's just that blank wait. You do not want to get frustrated at that spot, because if one door closes, the second one will definitely open.
Okay. Yeah. So, like, being someone who's so much ardent about research working right from the initial phase of his medical school. So, like, how much is it important for like internal medicine? And what is your perspective over it?
So research is for me and always a supplement to what we are studying. Uh, it's something where you still want to expand on a topic which you are going through in your medical school. So even I started my research right when I was in my first year of MBBS, and the reason I was because whenever I would go ask doubts to my professors in their cabin, I would always ask them, and sometimes they say, "Oh, this is something beyond. You need to search on Google." And in my first year, I came across Google Scholar and PubMed, where I started to know, okay, there are some research papers which actually draw the data, and from there the textbooks are made. So this attracted me that, okay, if I am able to finish the textbook, maybe that for that topic I would be able to search for some more literature. That's where you land on research. Now there are different forms of research, and definitely when you come to community medicine subject, you will study all of them in that subject about different types of research. So I always wanted to do something where I can stay active. And something which can supplement my knowledge. So in first year, I picked up a topic from anatomy and did it. From second year, I picked up a topic from pharmacology and did it. Third year, I went ahead with again a topic in clinical sciences about healthcare and improvement projects, and I did it. So finally, I could not, because the books were too voluminous to complete. And internship, definitely there was a lot of work and ongoing COVID duties, and everybody was struggling through their own battles, so could not. But this is where I have found that all this research was teaching me something, and this helped me not go with zero knowledge into my research position which I secured, but I had some basic knowledge which I could reflect, and they liked me into the research program or the research fellowship which I did in the United States. There's a lot to learn always in research, but it's not the primary thing for an internal medicine candidate. For an internal medicine candidate, the first thing is to manage your patients, is to learn how to talk to your patients, is to establish a good communication, and to have good clinical experiences in the United States, because that would be your primary task as an incoming resident. Secondly, research will help you in securing a fellowship and will help you to project your interest in knowing the literature beyond text. So there's where research will supplement you into understanding and training into the setup and the of any of future endeavors. I have seen many of my friends who have not had anything on the research profile, and yet they match. So it's not just always that research is the core thing. If that's where I come up, like if you love doing it, go ahead. If you
Okay.
don't, it's okay. There are other ways too.
Yeah, definitely. Because most of the people just lack in this, that research part. They're just hopping around everywhere, but they get nothing from that in the end. But like from
Very
your
true.
side, it's a good, like you had that approach from the initial phase of your med school.
Yes, I would thank my professors and mentors in med school who supported the idea and also guided me through the process.
Okay. So like also you mentioned this, like you were a surgery person before. But after some of your clinical rotation, your first clinical rotation, you just switched to this internal medicine part. So, what was that particular trigger or like particular thing that made you diverse this side?
Yeah, that's an interesting tale because almost throughout my medical school, I used to attend surgeries and think that,
Hmm.
hey, maybe one day I'll have my OR where I get scrubbed and I would enter my OR and work. But soon, somehow, getting inclined to reading and getting inclined more to diagnostics, it was more fun in knowing what the person is suffering and is bringing that person to OR than just thinking about what's there in OR.
Okay.
That's where I started inclining to diagnostic part. While presenting cases in my final year of med school, I was always inquisitive about taking a detailed history and trying to find all the differentials which you could quote for the patient. And there where I started somehow switching to medicine, but did not yet know whether I'm fit for the medicine. This first rotation I got was under an IMG doctor, and when he saw me through, he said, "Yeah, you are meant for medicine. I think you are meant for medicine, and you should choose medicine." That's where I felt more comfortable and more streamlined with the thought that, okay, I think I'm a person made for medicine, and I should pursue this.
Got it. Because most of the person from the start, what they have the thought, they continue with that, but most of them change it in their internship phase when they properly do their hands on. They're like, oh my God, no, I am interested in this more rather than that. It happens.
Very true. And majority of us were definitely devoid of uh, proper exposures due to COVID.
Definitely. Yeah.
So a lot of us were still dicey in that phase. But I was more sure right before, somehow luckily, more sure right before from the exposures I had.
Okay. Things quite have fallen for you. Little bit.
Yeah.
We can say. Okay. So from the determination, like working every year on the research project to matching on your like fresh graduate form, your submission reflects what a diligent student you were.
Thank you. I would say we all are diligent, but it's it's in our face that there are times where we will go astray. Every time there are a lot of times we'll go astray, and do not hesitate to ask for help. That's where that's where I say they use the famous dialogue of Harry Potter, which says that help is always offered in Hogwarts. I would say help is always offered to an IMG in a
Oh,
USMLE journey
if you ask for it.
if you ask for it.
Yeah. So like what was that thing that kept you so grounded till your from your whole journey? Like I can see
Uh,
that. Whenever I'm telling you something, you're like, we all are that. You appreciate that thing. It's really nice from your side.
yes, I always would say that I we all seek help and we all offer help. So it's just we growing together. And when we'll have the concept of broader we, it's better for like we'll bond faster with the candidates who we are working together, and that's how we learn more. That's how we also somehow get to know more about ourselves, our limitations, and sometimes there are certain limitations we have in our setup which gets corrected by them. Ambiguity being one. I always say that I'm a lot ambiguous at times, but that's where I say, okay, it's we, and where everybody pitches in, and I feel okay, we are on the right track.
Okay.
So it's always we.
Okay. That's a great thought from your side.
Thank
Okay.
you.
So like how do you define success?
Uh, Success for me would be rather a bigger process of journey and not just the end result. So definitely the success is not just the results which are coming in, but thanks for the hard work you did do the whole process to get it. The harder it is, the like more enjoying part would be that you achieved it. If it comes very easily to you, it won't taste that well as like the joy of getting it the harder way.
Okay.
For me, success is just about the journey, and it's not just the result.
Okay. How you cross it, how you live it, not just
Yep,
the end destination.
yep. The
Okay.
process.
The process. Got it. It was really lovely talking to you, Dr. Kunj, and we really
Thank
appreciate
you.
your time you took out for us.
Thank you. I'm sorry, I'm a little wordy. I go around a
No,
lot, talking a lot of things. So if there are any specific questions I failed to answer, please let me know. I'll be happy to come
no,
back and answer you for that.
definitely. It was a really amazing session with you we had, and we will wish you
Thank you.
all the very best for your upcoming prospects in life and the new phase that is
Thank you.
coming to you, that is residency. Hope you enjoy that
Thank
a
you.
lot.
Thank you. Thank you so much.
Yeah. Goodbye.
Best of luck to you too, and best of luck to all my IMG colleagues. It's okay to fall back sometimes, but it's always like please go ahead and ask help. People will be there to rescue you, and you'll rise again. So do not hesitate.
Thank you for this
That's my
appreciating
closing
message.
message. So
Yeah.
best of luck to you, all of you.
Thank you. Bye bye.